Hello, everyone, and welcome to our show Leadership Talks Cancer Awareness Edition. I'm Simran Chaudhary, and I welcome you on behalf of Voice of Healthcare to a unique series where we interact with the industry leaders, experts who are striving continuously to be innovators of the healthcares, who are continuously working to bring the change, positive impact in the society, to help the society to be a better and a healthy world, or let's say a country. For the session, we have our guest, Mr. Harish Trivedi, who is the Group Chief Officer, South Asia, American Oncology Institute. Welcome to our show, Mr. Harish.
Thank you, Simran, for having me.
Thank you. And before we proceed, I would just like to give a brief introduction about Mr. Harish Trivedi. Is that he has more than 28 years of experience in various organizations of healthcare, and he is known for his expertise and leadership for operational execution in organizations. And he that is the strong point of Mr. Harish, and I believe his works, his experience speaks about it.
Thank you, Simran.
So, we know, Harish, that you're working in this sector for a very long time and you have the experience or, the leadership of this. I just want to know how your organization is navigating to this unique challenges on your region for the cancer treatment landscape. How are you guys working?
Thank you, Simran. Before we move to the question, we need to understand how the market or the cancer in India is. If you look at the 2022 cancer incident figure, then it's round about 14 lakh 78,000. That means more than the- what 150 patients per lakh population. And we need to understand cancer is a very complex disease. And why I say so, because most of the cancer detected in the stage 3 and 4, because purely because of the awareness issue, we don't, so there is not much of a awareness, or I'll say the detection. So that's the reason by the time a patient come to know, or the family comes to know that somebody is suffering from the cancer, it is too late. And then it's difficult, even for
Yeah.
the family and the patients both. So that's the reason I say cancer is a very complex disease. And if I have to say what we are doing about it, so then the very first thing is about the education and awareness. Education in the society in general, how we can create the awareness about the early detection and prevention. If we can do that, then I'm sure we'll be able to help a lot of patients. What is also very important is the how it is the accessibility of the treatment.
Hmm.
And you see the landscape of India, most of the good hospitals or institutions are available in metro cities and tier A cities. Where, or other side, if we look, the 75% of the fantastic clinicians are available in the similarly in the class A and metro cities, but 75% of the population is available in the rural or semi-urban area. So it's a complete imbalance. So how
Hmm.
we can provide the access for cancer care to the patient and family all across, and there's a reason we are focusing in tier 3 and tier 4 cities. And there's a reason, if you see our presence, which is there from Jammu in the north, and if you look at the south, it is in
Hmm.
Calicut. We
Yeah.
also look from the west, it is in Nagpur, and east is the Imphal, where most of the players are not available. So we are remain focused. So how we can ensure the accessibility of a treatment for the patient. So that's the another important point. What is very important is how we can provide the latest available technology to our patients in even tier 3 and tier 4 cities, where, like I said, most of the hospitals and the best treatment is available in the metros and tier A class cities. We ensure that similar kind of, or maybe a better technology which is available. So you will see most of our centers are equipped with the most of the latest infrastructure and technological advancement. Some of the centers where we use the artificial intelligence, genomics, digital health, and provide the best of the available cancer care to the patient. Another important point, what we need to focus is the patient centric care. Like I said, this is a very complex disease, and once anyone knows that they have been diagnosed with the cancer, not only the patient but the entire family is under a lot of stress. So, how we can stand by our patient in their most difficult time and provide the unparalleled experience and the best of available care to our patients. So, that's the another critical point for us. What we are doing, as I'm sure you know, that we Cancer Treatment Service International is a part of Varian, and Varian is taken over by the Siemens. So we are now 100% subsidiary of Siemens Healthineers, and these are the both the companies are manufacturer of this latest technology and software, which is provided for the best of the cancer care. And
Hmm.
that's how we are focusing on the research and development in collaboration with our organization. At the same time, we are also collaborating, and since you know our model is we work in the hospital, so we work with a lot of government institution, pharmaceutical companies, healthcare and government. We work very closely with the Telangana government in developing the policy or
Yeah.
the how the best treatment can be provided for the all the cancer patients in Telangana. So that's how we are working very closely with all the stakeholders.
That's very well said, Mr. Harish, because when a group actually works from 360-degree, he has to be attached with all the verticals of their sector, whether it's like you said, the pharmaceuticals, the diagnostics, and everyone who else is the stakeholder in this. And that way together they can, work and bring the impact, what their vision is to improve the society.
That's true.
And my next question is related to the same line only, because how does you or envision your future, future of organization, and what does, like, how do you think that you can bring those things on the table in your tenure, or how does your hard work will help to drive that innovation for the growth of the organization?
So when you talk about the innovation and growth in any organization, be it in a
Mhm.
cancer care or in healthcare, what is very important is the strategic vision the leader has.
Yeah.
And when we talk about the strategic vision, we are talking about the long-term goal. We also need to identify how the healthcare is moving forward. See, basically in India, the healthcare, how we are approaching healthcare is the curative approach. And when I say curative approach, that means when the patient is unwell, he will go to hospital, get treated, and come back.
Hmm.
And then during the pandemic, we have realized we don't have enough beds uh, in our country, and we have the largest population. So now, what the shift which we are seeing from the curative to preventive, after the pandemic, everybody has taken ownership of their health. They are
Hmm.
focusing how you can prevent the disease. So we have the largest NCDs, non-communicable disease, and the burden is very high. So we
Hmm.
need to encourage our population or the patient and their family how they can prevent by undergoing a lot of tests. And unless and until, so they need to take care of ownership of their health, and unless and until they are unwell or require some surgical or a procedure, they will go to hospital and come back very quickly. So from curative approach we are moving to preventive. So that's the another trend which we are seeing at this point of time. At the same time, in cancer care we are seeing a lot of new therapy which is coming up, a lot of new technology which is coming. So we need to be on top of it all the time and see how we can quickly adapt and then be agile organization. Another key point is the innovation, and innovation in terms of the cancer care. We need to be creative, we need to be taking a risk, and we need to look at the continuous improvement all the time in the way we provide the treatment to our patients. How we can bring the improvement in the team which is working and then providing the care, which is our clinician. And this also at times involve a lot of investment, research, development, and what is very important, the interdisciplinary collaboration which we need to have.
Hmm.
So for a one patient, for example, so what we do in our cases, if any patient comes, we have a tumor board, and since we have this international tie-up, we have access to international tumor board. Any single patient has access to all the clinician from the stream, be it a surgical, medical, or radiation, or for the lab. I'm sure you must be aware that we have also got a diagnostic arm, which is
Yeah.
empath. So everybody comes together and take the decision in a tumor board what is right for the patient. So that's the another approach we are following. And then, like I've said, it is the patient centric approach all the time. That means how we can put our patients and their family at the center of our decision making, how we prioritize their needs and preferences.
Hmm.
Uh, Now, the entire cancer treatment is moving very personalized, immunotherapy, genomics. So we need to put the patients and whatever we are doing.
Hmm.
Another very important thing is how we can invest in the talent. When I say, it can be a clinical talent and non-clinical talent, or a paramedic talent. We need to have the best of the clinician with the proven clinical outcome be a part of the organization. At the same time, when I say it is the complex disease, apart from having the best clinical talent, it is also important your entire non-medical team or a paramedical team needs to be a patient-centric, where we need to be stand by our patients and provide unparalleled experience. What is last but not the least important point is, like I said, we need to collaborate with a lot of partners, be it the partners who where we are already running our centers, some of the medical colleges, where we find it is difficult to get the access to the treatment. And what is very important is to remain ethical and being a responsible leader. And when I say that, it means we need to committed to be a socially responsible organization and provide equitable access to
Hmm.
all our patients all the time, and believe in the inclusion. So that's what I'll say, simply.
Yeah, and the marking, the genome testing, and the new how innovations is actually working in this field to change from curative to preventive is actually working, and that is all because I believe the leaders out there in this sector who are consciously working for this, and it has helped a lot to make the uh, treatment more personalized. And it's great of you, the organizations who are working in this field, to continuously make that happen actually, and save people from this disastrous or the most dangerous illness, I believe, that is cancer. And like you also explained how complex it is, it does not affect one person, it affects the complete family and the people related to them.
So, Simran, I'll just like to add one point.
Yeah.
I'll not say it's a disastrous. The only problem we have in the cancer is we detection of the disease is too late. If
Hmm.
we create the awareness and detect the cancer early, then cancer is conquerable. You can easily win over the cancer. So we all need to understand, though cancer is a complex, but if we take care of our health, doing the prevention, early
Hmm.
detection, awareness in our family, in our society, then I'm sure we can easily win over cancer.
Correct, correct. That's very well said. And like we are talking about like how things are working, and more importantly how awareness is required, because its detection is late because the symptoms doesn't happen early and it gets detected at a later stage only. So in this dynamic healthcare environment, what approach do you use for decision making to make sure that the organization remains at the forefront of the cancer treatment in the South Asian market itself?
So, Simran, what we do is we take our decision based on the data.
Hmm.
And when I say, we do a lot of data analytics, and the all the treatment are evidence based or research based, and
Hmm.
that's how we take our decision making. That's how we follow our decision making process. That means analyzing the clinical outcome, patient demographic, market trends, healthcare metrics, identify the area of improvement and the opportunity for the innovation. So
Hmm.
we remain focused all the time on the different data and then they take the decision. Another critical point is the stakeholder management. I said we need to engage with the clinician, patients, caregiver, researchers, policymaker, industry partners. So these are the different people provide us a diverse perspective and insights, and we need to collaborate with multidisciplinary team to brainstorming, evaluate the potential strategies, how we can take the informed decision and align with the overall mission and goal.
Hmm.
Also very important that how we are continuously monitoring and doing our evaluation. So we need to do the evaluation of the clinical practices in the healthcare sector or the new development. In cancer, there are a lot of treatment protocols,
Hmm.
and we do remain focused on the clinical outcome. So this we keep on doing on the periodically on the regular basis. Like I said, while doing all this, we need to be agile organization and quickly adapt to the
Hmm.
changes which are happening in the industry in terms of the technology, all the advancement which I talked about in the different therapy. And then in a dynamic country like ours, there are a lot of regulatory changes also keep on happening. So we need to be aware of it and quickly adapt to the emerging trends in the cancer care.
Yeah.
Like I've also mentioned earlier, there are a lot of investment which requires in innovations, and then we ensure that wherever we run the any cancer center, we provide a 360-degree care to all our patients. Once they enter, they don't have to go outside for any other treatment. So
Hmm.
that we ensure, and we strategically align to different partners and then collaboration in the different geographies where we work with the partners in providing the cancer care. And in the end, what remains very important in cancer care is the patient centric approach all the time. That's how we take our decision.
That's great, and the collaboration partnership is actually very required to work this in this big region where you are fostering to one of the biggest, you know, the thing which is affecting the community a lot, that is cancer. We are just talking about. But the next question comes from this only, like how are you effectively collaborating and partnership doing this partnership within this healthcare industry in South Asia?
So again, what is very critical is having the how we are collaborating is important is the multidisciplinary care team.
Hmm.
Uh, we are international organization and we also have a tie-up with the UPMC, which is a world-renowned institute,
Hmm.
which help us in running our international tumor board. If we require any say technological advancement or a guidance, or
Hmm.
there are a lot of development which is happening on the AI front. So we do a lot of clinical research, work on the data, and help the team in improving the overall clinical care. So we work in a multidisciplinary clinical care team. Another thing is a strategic partnership. So we identify the market which is underserved and where the cancer incidence is very high. So I just gave you example of the Imphal or Manipur area, and then it has been one of the difficult market from the last 1 or 2 years. But even in those difficult circumstances, our north has the highest cancer incidence. So we already present and we are launching a lot of innovatives or bringing the lot of technologies which is very for the first time in the entire Manipur area or maybe the second in the entire northeast area. So we see where the it is underserved area, how we can work with the government and the partners and find out the strategic partnership in the key region or a geography.
Hmm.
Another critical area is community outreach program. Like I
Yeah.
said, we need to create a lot of education. So we need to do a lot of outreach program, tie up with the educational seminars, awareness campaign,
Yeah.
do a lot of camp, screening of the patient wherever it is possible. And then, like breast cancer again and head
Yes.
and neck is the highest cancer incident in India. And there are a lot of easily available tests which can be performed in the convenience of the patient, even if it is not in the hospital environment. Outside hospital, we can also perform the test and screen the patients and see how we can promote the early cancer detection, prevention, and provide the access of care to the underserved areas. And post pandemic, we have realized now even the patients and general population are adapting to the technologies. We Indian are very smart. When we see the value for money, it is not the technology which is hindrance, it is the value for money. So we
Yeah.
are seeing a lot of awareness and improvement in the consultation over a telemedicine teleconsultation. So that's also we are providing to the area where it is underserved. We are investing a lot of money in new technology and in research. We do a lot of research work with the help of our international tie-up, and we are part of the innovation consortia. Like I have also mentioned about the global partnership on which we focus. So how we have very close tie-up with the Varian, Siemens Healthineers, and the innovative and very renowned clinician across the globe that is helping us and in driving the cancer care all across.
Yes, and that is required. Like you guys are also targeting this northeastern region wala area where, and the ways you are actually implementing all those policies to create this awareness campaigns through reaching out to the houses who does this actually, to educate people is required at this moment of time because to create the awareness is necessary. And if we I have to ask about the key priorities or the strategic vision of your team for the coming years in the organization, like how does you will you think that what are the first I just want to know what are the objectives you want to achieve in this coming years for the organization, and how are you proceeding for it? Because the kind of experience expertise you have, we want to know how fast forwardly you can take this and so that we can also learn.
For me, number one priority will always remain the enhancing the patient centric care.
Hmm.
If you see my career, it is just from this last 14 years I'm in healthcare. Prior to this, I have worked in FMCG company. Then I was in telecom sector. I was in retail sector,
Yeah.
where I or we used to deal with the product and services.
Hmm.
But in healthcare, and especially now last 8 years dedicatedly in cancer care, we are dealing with the invaluable human life. Sometimes we don't even understand the value of every single human being, but it is the family who understands.
Correct.
And like I said, cancer is difficult, complex. It's very burdening, taxing for the patient, and we all know the insurance penetration. But it is good that central government has come up with the PMJ, where a lot of patients and families are covered under insurance.
Hmm.
That is helping, but still out of pocket expenses of the cancer burden disease is very high on Indian population. uh, and it's a difficult time. So how we can provide the can patient centric care, where we create all the processes, access, and then support around the patient being the center. So that's will always remain my objective number one. Second is how we can expand our access and equitable access of clinical treatment to all the patients all across.
Hmm.
We know, like in the initial I discussed, it is the metro cities and A-class cities where most of the care is just focused and centered, where we would like to reach out the tier 3, tier 4 cities, which is underserved. And
Hmm.
patient have now right now patient have to travel all the way. Apart from the treatment cost, patient need to bear a lot of other costs like traveling costs, going out and staying in another city for a long time for the treatment. So how we can reach out to a patient at their doorstep in their geographies and provide access. Like I said, what is very important is the equitable access.
Yeah.
That means we are treating all the patients in the same fashion, be it is coming from the lower strata of the society, or having the lot of cash. We should treat all the patients equally and provide the good treatment and then focus on the clinical outcome. We also need to adapt to the evolving healthcare landscape, because we know it is very dynamic and it is changing very fast. So we need to quickly adapt to the new treatment protocol or therapy which is coming. So we remain on the top of everything, and if there is any new development, we ensure that how we can get it in India and provide the best care to our patients. While doing all this, what is very remain important is how we remain engaged with our clinician and focus on the development of our employees.
Hmm.
Because I firmly believe if we are taking care of our employees and our clinician, they will take care of our patients. And then we remain very engaged with our clinicians and our employees. Will invest a lot of resources
Yeah.
for the training and development of clinicians and all the employees who are working in providing best care to our patients. Another key area is regulatory compliances and the quality.
Hmm.
Like I said, we are the dynamic countries. A lot of changes we see all the time. A lot of selling or the restriction on the or the capping on the margin or the rates of the drug. A lot of compliances we need to comply with all across. And what is very important is the how we are providing the quality care to our patients, for which we have the clinical dashboard, quality parameters, nursing parameters, and we track uh, ourselves with the best of the uh, I'll say outcome
Hmm.
on the same parameters across the globe and across India. Right now, though we don't have any central regulatory authority, but I'm sure that is required at some point of time going forward, which publishes all the data of clinical outcome and all the quality parameters, so we know in India that which are the organization or institute which provide the best quality care. Right now it is word to mouth, but we don't have any comparative data at this point of time. So that's the another area. And last but not the least, how we can strengthen the partnership and collaboration with the different stakeholder, which I have already discussed. So these are
Yeah.
some of the key priorities for me and my organization.
Very, thoughtfully picked up all those priorities. I believe there's a lot of strategy went on to decide that, and the most great one, which I liked, and I believe only a person who is actually visioning to expanding in terms of every aspect, from the employment satisfaction to patient centric to globally expanding. I really like the way you explained this employees development. Actually, when you keep your employees happy, you make them feel you are actually developing in the professional as well as personal way, and you're providing all the resources required for them so that they are satisfied and they feel like coming to work, they feel like doing their best for their work for the patient. And when they are actually working for the organization with their 100% capacity, the organization will eventually grow.
No, no, I'm sure, and that's the need of the hour,
Yes.
and it's a time we all need to contribute in whichever we can. Like you are here and creating
Yes.
a lot of awareness,
Yeah.
so we all stakeholder needs to chip in and
Yeah.
do our best how we can bring the awareness in and around cancer, so we can have early detection and we can cure the cancer.
Very well said. We all are working for the same cause, and we all are working to create this awareness amongst the society so that we can together fight this cancer and protect everyone else out there from this. And that's how the innovations are coming out to help everyone.
I'll just add one word: let's conquer the cancer.
Yes, very well said. Let's conquer the cancer. Yes. Thank you so much, Mr. Harish. It was a great session, very insightful session from all the aspects, from the leadership, how American Oncology Institute is working for that, for the cause, and how greatly it is impacting the society overall. Thank you so much for your time and sharing your experience and insights. Thank you so much.
Thank you, Sivaran, for giving this opportunity. It's absolute pleasure. Thank you so very much for your time.